Hello everyone, in today's video we're going to talk about a few pointers on how to remember causes of amenorrhea. We're going to cover both primary and secondary. Primary amenorrhea is termed whenever a girl doesn't attain menses by the age of 15 years, irrespective of whether the secondary sexual characters have developed or not. Whereas if the secondary sexual characters have developed and the girl doesn't attain menarche by the age of 13 years, then that also can be considered as primary amenorrhea. Before we go to the causes, let's revise the HPO axis. The hypothalamus secretes GnRH, which then acts on the pituitary gland, basically the anterior pituitary gland, where it secretes FSH and LH, and this FSH and LH acts on the ovaries, which then undergo the ovarian cycle and then produce estrogen and progesterone, and estrogen acts on the endometrium, leading to the proliferation of the endometrium, and then progesterone causes secretory changes, and withdrawal of estrogen and progesterone leads to menstruation. Now, coming to the causes of amenorrhea, the right side of the page, I'll be writing the causes of primary amenorrhea, whereas the left side, I'll be covering the secondary amenorrhea causes. Now, coming to the how to remember the causes of amenorrhea. Easy way to remember this is to divide the whole HPO axis and the uterus into compartments. The first compartment mainly consists of the blue box, that is the outlet, that is the uterus, the cervix, and the vagina. So when we are considering the causes of primary amenorrhea, imagine at this level there is an obstruction to outflow. So that will be an imperforated hymen. So that will be one of the cause. Coming to the vagina, if there is a septum which is occluding the outflow of the menses, like a horizontal or a transverse vaginal septum or a longitudinal vaginal septum which is causing obstruction, that is a non-communicating vaginal septum. Coming to the level of the cervix, if there is agenesis or atresia of the cervix during Mullerian development, agenesis, atresia of the cervix, that can also present with primary amenorrhea. Coming to the uterus, basically it's Mullerian agenesis which can cause primary amenorrhea. Keep in mind, Mullerian developmental problems like diadelphous uterus, unicornuate uterus, they do not present with primary amenorrhea. It's more of the complete agenesis of the uterus during Mullerian development, or in conditions like MRKH syndrome or androgen insensitivity syndrome, where there is an absent uterus. In those cases, primary amenorrhea will be a feature of this Mullerian agenesis. These were the features in compartment 1, or the causes in compartment 1 which were leading to primary amenorrhea. Now, same compartment if you're considering secondary amenorrhea, then what all do we consider? Secondary amenorrhea is a woman who has attained menarche, she's had cycles, and now she's not having cycles. Most common whenever a woman comes with secondary amenorrhea, always rule out pregnancy first. That is the primary concern. Once you've ruled that out, again, compartment 1, unlikely imperforate hymen, unlikely a horizontal septum, but a vaginal adhesions can be there, which is obstructing the flow of menses, like in case of tuberculosis or any scarring of the vagina due to procedures on the vagina, that can lead to secondary amenorrhea. In cervix, basically it is the cervical adhesions which are causing it. So after procedures like conization, LEEP, LETS, or cervical atresia because of cervical blockage due to CA cervix, that can also present with secondary amenorrhea. Then uterine causes. Uterine causes are basically iatrogenic in nature in cases of secondary amenorrhea. So what happens if a woman has undergone a DNC and there is extensive DNC which is done, which has damaged the basal layer of the endometrium? In such cases, a lot of adhesions develop inside the endometrium. We basically term this as the Asherman syndrome. So in Asherman syndrome, due to destruction of the basal layer of the endometrium and adhesions, there will be outflow obstruction, or there will be destruction of the basal layer, and hence presenting with secondary amenorrhea. So think of all these causes when you're thinking of compartment 1 in primary amenorrhea and secondary amenorrhea. Now coming to compartment 2. Compartment 2 is the one in green, basically anything which is involving the ovary. So in case of primary amenorrhea, if you want to remember the compartment 2 problems, it's basically gonadal dysgenesis. So when does gonadal dysgenesis occur? Either there is no development of the gonads, like in Turner's or Turner mosaic, where the ovarian tissue has not developed enough to lead to secondary sexual characters or even menses. So gonadal dysgenesis, or even gonadal other problems, like if a woman is AIS, it will be a XY. Okay, so in those conditions also, or it will be XY with complete gonadal dysgenesis, as in Sawyer syndrome. So those are the causes for compartment 2 causing primary amenorrhea. But there are other diseases in India which can lead to dysfunction of the ovary, leading to no production of estrogen and progesterone. The most common out of them is tuberculosis. Tuberculosis causing oophorytis, causing complete ovarian failure, can lead to presentation of primary amenorrhea. Or if the girl has undergone surgical oophorectomy, radiation, or chemotherapy for multiple malignancies of the ovary, like germ cell tumors, which is very, very unlikely that bilateral oophorectomy has been done in a girl, but still possibility. So all these history has to be asked, leading to ovary. But there are other few conditions which affect the ovary, that is compartment 2, which can present in both primary and secondary, which usually affects the ovarian part, but it's not the pathology is not in the ovary. For example, if the woman has hypothyroidism or even hyperthyroidism, then it will cause anovulation, leading to uh, amenorrhea. So it can be in both primary and secondary. Even Cushing's syndrome, Cushing's disease, causing anovulatory cycles can present like that. So these are the conditions you'll remember in compartment 2. Compartment 2, if you want to remember the causes in secondary amenorrhea as well, you still remember the same: RT, history of chemotherapy, history of any surgery, history of tuberculosis. Okay, PCOS is an important condition which can present with secondary amenorrhea because of anovulatory cycles. Again, rule out endocrine disorders. Okay, so these are the causes you will rule out in secondary disease. Coming to compartment 3, that is the pituitary gland. So it can be a deficiency of the GnRH acting on the pituitary gland. It can be tumors like craniopharyngiomas. It can be space occupying lesion like tuberculosis, any tumors, or it can be even in secondary amenorrhea, it can be even stroke. One of the important cause of secondary amenorrhea which acts on the pituitary is the Sheehan's syndrome. In that, it is called as pituitary apoplexy, in which there will be sudden hypotension postpartum and there will be sudden pituitary necrosis leading to deficiency of all the pituitary gland hormones. Okay, see, these are the causes you will remember in pituitary gland. In hypothalamus, most importantly, you're going to remember is constitutional delay. If there is similar familial history in the sister, in the mother, in the grandmother of delayed puberty, it's a common cause. Then malnutrition, because it reduces the GnRH pulsatile nature, hyperprolactinemia, okay, then space occupying lesion again, like tuberculosis, okay, then any intracranial space occupying lesions, craniopharyngiomas can occur. These are also causing all of this. Stress induced amenorrhea can occur both in primary and secondary. Mainly it affects the GnRH pulsatility and hence disrupt the HPO axis, leading to amenorrhea. So these are the things which you should remember in the different parts of the HPO axis which lead to both primary and secondary amenorrhea. One